One of the most robust initiatives that we have implemented in the emergency department was the notification of PCP, which seemed like a very simple process when we started the application process. It became very evolved and is now one of the biggest successes from this whole process. The callback program is a way that we have created to identify patients 70 and older that are discharged from the emergency department. They will receive a call from myself or one of our teammates and to check in, make sure they understood their discharge instructions, to see if they had any questions about their stay, to make sure they have follow-up, and to help assist them with getting any specialty care or referrals. Sometimes this means getting them a PCP for the first time, and sometimes it means just helping get them an appointment in a timely manner. One of my favorite stories that has come from the accreditation process occurred with our follow-up program. An 80-year-old female had come into the emergency department over the weekend with lower back pain. There was no trauma, no known cause. Her pain was 10 out of 10. We sent her home with over-the-counter pain medications and a lidoderm patch. Within a few days, I recalled her for the follow-up. The patient was obviously having a significant amount of pain. Her husband had answered the phone and said, "She's not doing well, and I don't think you're going to be able to help her unless you have a magic wand." She was able to get an appointment with her primary care for a few weeks or so from the ED visit, and she was referred to the pain clinic but wouldn't be able to be seen for approximately 3 months. The patient was in tears, so there was nothing that she could do, and the pain continued to be terrible. This was unacceptable in my mind, and so I called our associated primary care office to see if there was something they could do. They heard her story. They said, "We will absolutely see her today." At the same time, they also talked to their pain clinic, who was able to see her within a few days. When I called back, the husband answered the phone and said, "Well, did you find the magic wand?" And I said, "Yeah, I think I did." The lady got on the phone, and I told her that she had an appointment in just a few hours and that she would be following up with pain in a few days. She began to cry with gratitude and said, "I used to be a nurse, and I would have been privileged to work alongside you and your team for your kindness and your compassion." At that moment in time, I knew that the callback program was essential for my community and that we needed to make sure that we kept it as a robust program. If I can recommend one process or one initiative to really invest in, it would be the follow-up process after discharge. We often will send patients out with robust plans, but we leave it to them to have to do self-advocacy. And that is very trying, even when we are in the best of health. So finding ways to prevent them from having gaps in care, because care doesn't end at the ambulance bay doors. We all need to be part of the process to ensure that they have the lifelines they need to get to the next portion of the care that's needed.